I'm Gary Chimes from Lake Washington Sports and Spine, and what we're going to talk about today is listening, specifically the idea of listening in the context of a medical visit. One of the frequent pieces of feedback we hear from patients is, I want to have a doctor who really listens to me. One of the things I really want to point out is that means different types of listening are appropriate in different contexts. And we're going to actually think of that as a continuum. We're going to have on one side what they call emotional support. And another thing we're going to talk about is emergency triage. Okay. So let's say we're dealing with a situation like there's a loved one that you really care about and their dog dies. At that point, what they really need from a listening standpoint is emotional support. They need to know that the person they're talking about has a vested rooting interest in their success, helping them feel better, and they just really need someone to vent to. So that's going to be fairly far along the continuum. And let me just get another color. I'll use red. Where they really need the main purpose of the conversation to be about emotional support. Let's now imagine another circumstance. Let's imagine that you're in the middle of a building crashing down, sort of like a Twin Towers accident, and you're trying to triage bodies to get bodies out of a building that might be crashing down. In that context, when the, let's say, emergency rescue worker or fireman is looking for a body where there may be limited time, when they're asking questions, it's really not about emotional support. It's about trying to triage and potentially save lives. So that might be a fairly extreme end of the continuum. Another circumstance that happens in the context of medical visits would be some type of emergency trauma. So let's say somebody's in a car accident and they're bleeding out and they need to know about medications to make sure that they're making appropriate decisions for an emergency surgery. Again, at that moment, the crux of the conversation is not about emotional support. That might be somewhere else on the continuum. One of the really important points as somebody who's going to someone and saying, hey, I'd like you to listen to me, is recognizing that a continuum even exists. My experience is that while emotional support is really important, in the context of a physician's visit, you have some aspect of emergency triage and emotional support, and it's really going to depend on the context of the visit, how far on this continuum you need to be. So, for example, oftentimes if you're just trying to establish new care with a primary care physician, you really can be somewhere on this part of the spectrum where you're really just trying to see, is this someone I feel comfortable with? Is this someone whose style I like? Is this someone whose judgment I'm going to trust? You're really just trying to develop a rapport. Now, when you come to see me, I'm a specialist. I'm a sports and spine specialist. I'm often being seen after you've already been seen by other doctors, and oftentimes it's for a problem that you need specifically fixed. Whether it's a problem with a frozen shoulder, a problem with a non-insertional Achilles tendinopathy, or a problem with radiculopathy from a herniated disc, you often have a very specific problem that you need fixed. So for me, when I'm seeing the patient, I need to do a different kind of listening, and specifically a reflective listening. So if a patient says to me, you know what I mean, because they're having trouble articulating their words, from an emotional support standpoint, I can say, yeah, I understand you're having a problem, but that doesn't give me the specific details that I need to know. So I'm often going to be using tools where I'll be saying things often in terms of like yes, no type questions, like yes or no, do you have any pain on the left side? That really helps me clarify and give a better diagnosis. So compared to a primary care physician, I may be further along on the continuum. We're not dealing with emergency trauma, but in the context of the visit, it's really important for me to be able to problem solve. Now, the fact of the matter is different kinds of visits have different kinds of roles. So I've seen certain patients for one condition where I may be further along on the emotional support spectrum, but let's say they have like an acute herniated disc in their neck and their incapacity can't work. I really then need to be further along on the emergency triage form of reflective listening. And that's important for me to recognize. It's also important for the patient to recognize. And I often say, one of the things I try to do with patients to help clarify that this is a different kind of conversation is saying, just so you know, after a little bit of small talk to try and get some comfort, is saying this is actually going to be an interview rather than a conversation to really establish the type of conversation we're going to have. As a physician, this is always challenging. I sometimes run, for example, my girlfriend will often call me after work and we'll talk, and I'll often say to her, do you need me to be in emotional support mode or do you need me to be in problem solving mode? So different relationships will have different conversational styles at different times. The main thing I want to get across in this video is just recognizing that this triage, that this continuum even exists.